Hello, future healthcare professionals. Welcome to Nursing Exam Preparation, your go-to source for mastering the essential knowledge and skills needed for outstanding patient care. In today's video, we'll guide you through 250 true-false questions on patient safety and infection control, two critical areas in safeguarding patient health and preventing healthcare-associated risks. These questions are designed to test your understanding of key concepts in patient safety, infection prevention, and control measures. After each question, we'll provide detailed rationales to help you understand not only the correct answer, but also the reasoning behind it, empowering you to apply this knowledge in real-life healthcare settings. Whether you're just starting to dive into patient safety and infection control or preparing for exams, this video is packed with insights that will help you build a solid foundation, boost your confidence, and guide you to success. Don't forget to like, share, and subscribe to Nursing Exam Preparation for more expert-curated resources tailored to your learning needs. Hit the bell icon to stay updated with our latest videos. We're here to support your journey with engaging and practical content. Once you've completed the quiz, share your score in the comments below. We look forward to celebrating your progress. Let's dive into these questions and take a big step toward becoming a confident, knowledgeable healthcare professional. Ready? Let's get started. 1. Hand hygiene is the single most effective way to prevent the spread of infection in healthcare settings. True or false? Answer: true. Rationale: hand hygiene removes or kills microorganisms, preventing transmission between healthcare providers and patients. It is recommended by the CDC as the most effective method for reducing healthcare-associated infections, HAIs. 2. Sterile gloves are required for all patient care activities to prevent infection. True or false? Answer: false. Rationale: sterile gloves are only required for sterile procedures. Standard gloves are sufficient for most routine care tasks involving contact with blood, body fluids, or mucous membranes, in accordance with standard precautions. 3. Airborne precautions are necessary for patients with tuberculosis. True or false? Answer: true. Rationale: tuberculosis is transmitted via airborne particles. Airborne precautions, including the use of an N95 respirator and placing the patient in a negative pressure room, prevent the spread of the disease as recommended by CDC guidelines. 4. It is safe to recap-use needles after medication administration. True or false? Answer: false. Rationale: recapping needles increases the risk of needle stick injuries and is against OSHA standards. Proper disposal in a sharps container immediately after use is the recommended practice. 5. Alcohol-based hand rubs are less effective than soap and water for routine hand hygiene. True or false? Answer: false. Rationale: alcohol-based hand rubs are more effective than soap and water in most situations, except when hands are visibly soiled or contaminated with Clostridioides difficile spores, where soap and water are necessary. 6. Bed rails should always be raised for all patients to ensure safety. True or false? Answer: false. Rationale: bed rails can pose a fall risk or lead to entrapment if used improperly. Their use should be based on individual patient needs and risk assessments to ensure safety without compromising mobility. 7. Personal protective equipment, PPE, should be removed in a specific order to avoid contamination. True or false? Answer: true. Rationale: PPE should be removed in the correct order, e.g., gloves, gown, mask/face shield, to minimize the risk of contaminating oneself during removal, following CDC guidelines. 8. Healthcare providers should don a new pair of gloves for each patient encounter. True or false? Answer: true. Rationale: wearing new gloves for each patient encounter prevents cross-contamination and is a standard precaution to ensure patient and provider safety. 9. A patient with a history of falls should be placed in a room near the nurse's station. True or false? Answer: true. Rationale: placing patients with a history of falls near the nurse's station allows for closer monitoring and quicker response, reducing the risk of injury. 10. Disinfecting reusable medical equipment between patient uses is optional if the equipment appears clean. True or false? Answer: false. Rationale: All reusable medical equipment must be disinfected between uses, regardless of visible cleanliness, to prevent the spread of pathogens, as per infection control guidelines. 11. The use of alcohol-based hand rubs is sufficient after caring for a patient with Clostridioides difficile. True or false? Answer: false. Rationale: soap and water are required for hand hygiene after caring for patients with Clostridioides difficile, as alcohol-based hand rubs are ineffective against C. difficile spores. 12. Wearing gloves eliminates the need for hand hygiene. True or false? Answer: false. Rationale: gloves do not provide complete protection against contamination, and hand hygiene must be performed before donning and after removing gloves to prevent cross-contamination. 13. Patients with MRSA should be placed on contact precautions. True or false? Answer: true. Rationale: methicillin-resistant Staphylococcus aureus, MRSA, is spread through direct contact, and contact precautions help prevent its transmission to other patients and healthcare workers. 14. A sharps container should be replaced when it is 3/4 full. True or false? Answer: true. Rationale: overfilling sharps containers increases the risk of needle stick injuries. They should be replaced when 3/4 full, as recommended by OSHA. 15. Gowns must be worn when entering the room of a patient under droplet precautions. True or false? Answer: false. Rationale: gowns are not typically required for droplet precautions unless there is a risk of contact with infectious materials. Masks are the primary PPE used for droplet precautions. 16. The sterile field must remain at waist level or higher during a procedure. True or false? Answer: true. Rationale: maintaining the sterile field at waist level or higher ensures sterility and prevents contamination from inadvertent contact or environmental exposure. 17. The timeout process before surgery is used to confirm the correct patient, procedure, and site. True or false? Answer: true. Rationale: the timeout process is a critical patient safety measure to prevent surgical errors by verifying the correct patient, procedure, and site before surgery begins. 18. Healthcare-associated infections, HAIs, are often preventable with proper hand hygiene and infection control measures. True or false? Answer: true. Rationale: most HAIs can be prevented through evidence-based infection control practices such as hand hygiene, proper use of PPE, and adherence to sterilization and disinfection protocols. 19. All healthcare workers are required to receive annual training on infection control practices. True or false? Answer: true. Rationale: annual infection control training is mandated by OSHA to ensure healthcare workers are knowledgeable about current best practices and can maintain a safe environment for patients and themselves. 20. Wearing a surgical mask provides sufficient protection for aerosol-generating procedures. True or false? Answer: false. Rationale: an N95 respirator or equivalent is required for aerosol-generating procedures to prevent inhalation of airborne pathogens. Surgical masks do not provide sufficient filtration for such tasks. 21. Standard precautions should be applied to all patients regardless of their infection status. True or false? Answer: true. Rationale: standard precautions are the foundation of infection prevention and apply to all patients to minimize the risk of transmission of infectious agents in healthcare settings. 22. The 5 moments for hand hygiene include after touching a patient and before touching patient surroundings. True or false? Answer: true. Rationale: the WHO's 5 moments for hand hygiene outline key times for performing hand hygiene to prevent healthcare-associated infections, including after touching a patient and before touching their surroundings. 23. A gown must always be worn when assisting with a bed bath for a patient. True or false? Answer: false. Rationale: a gown is not required unless there is a risk of contact with blood, body fluids, or other infectious materials during the procedure. 24. Healthcare workers with open wounds on their hands should avoid direct patient care. True or false? Answer: true. Rationale: open wounds increase the risk of transmitting or acquiring infections. If unavoidable, proper coverage and PPE are essential. 25. Alcohol-based hand rubs should be used for at least 5 seconds to ensure effectiveness. True or false? Answer: false. Rationale: alcohol-based hand rubs should be used for at least 20 to 30 seconds to ensure sufficient time for the product to kill most microorganisms. 26. Patients with suspected measles should be placed on droplet precautions. True or false? Answer: false. Rationale: measles is an airborne disease, and airborne precautions, including an N95 respirator and a negative pressure room, are necessary to prevent its spread. 27. All surgical instruments must be sterilized before use. True or false? Answer: true. Rationale: sterilization of surgical instruments is critical to eliminate all microorganisms, including spores, and prevent surgical site infections. 28. A patient with active diarrhea should not use a shared bathroom. True or false? Answer: true. Rationale: shared bathrooms can increase the risk of cross-contamination. Patients with active diarrhea should use a private bathroom whenever possible. 29. Gloves should always be worn when changing a patient's linens. True or false? Answer: false. Rationale: gloves are only required when changing linens contaminated with blood, body fluids, or infectious materials. For clean linens, gloves are not necessary. 30. The influenza virus is primarily transmitted via direct contact. True or false? Answer: false. Rationale: the influenza virus is primarily transmitted through respiratory droplets produced when an infected person coughs, sneezes, or talks. 31. Proper donning of PPE should begin with hand hygiene. True or false? Answer: true. Rationale: performing hand hygiene is the first step in donning PPE to ensure that hands are free of contaminants before touching protective equipment. 32. A needle should always be recapped before disposal. True or false? Answer: false. Rationale: recapping needles increases the risk of needle stick injuries. Used needles should be disposed of in a sharps container without recapping. 33. Patients with tuberculosis, TB, should be placed in a room with negative pressure ventilation. True or false? Answer: true. Rationale: negative pressure ventilation prevents airborne particles from escaping the room, reducing the risk of TB transmission to others. 34. Isolation precautions are only necessary for patients with confirmed infections. True or false? Answer: false. Rationale: isolation precautions should be initiated for patients with suspected or confirmed infections to prevent the spread of infectious agents, even before laboratory confirmation. 35. Cleaning a surface with detergent removes all microorganisms. True or false? Answer: false. Rationale: cleaning removes dirt and organic material but does not eliminate all microorganisms. Disinfection or sterilization is required to kill most or all microorganisms. 36. Healthcare workers are required to report any exposure to blood-borne pathogens immediately. True or false? Answer: true. Rationale: prompt reporting of exposure to blood-borne pathogens ensures timely evaluation, prophylaxis, and follow-up care to reduce the risk of infection. 37. Using hand lotion after hand hygiene helps maintain skin integrity. True or false? Answer: true. Rationale: hand lotion prevents dryness and irritation caused by frequent hand hygiene, maintaining skin integrity and reducing the risk of skin breakdown. 38. A face shield can replace the need for a mask when caring for a patient with droplet precautions. True or false? Answer: false. Rationale: a face shield provides eye protection but does not replace the need for a mask, which protects against respiratory droplets. 39. Bed rails should always be raised for all patients to prevent falls. True or false? Answer: false. Rationale: bed rails should be used based on individual patient needs and assessments. Raising all bed rails can increase the risk of entrapment or injury for some patients. 40. Healthcare workers must perform hand hygiene after removing gloves. True or false? Answer: true. Rationale: gloves may have small holes or become contaminated during use, so hand hygiene is necessary after glove removal to eliminate any residual contamination. 41. Patients at high risk for falls should have fall prevention measures in place, such as non-slip socks. True or false? Answer: true. Rationale: non-slip socks, bed alarms, and other fall prevention strategies help reduce the risk of injury in patients identified as high risk for falls. 42. A single-use tourniquet should be discarded after use on one patient. True or false? Answer: true. Rationale: single-use tourniquets reduce the risk of cross-contamination and must be discarded after use on one patient. 43. Healthcare workers should avoid wearing artificial nails to reduce the risk of infection transmission. True or false? Answer: true. Rationale: artificial nails can harbor pathogens and increase the risk of transmitting infections, particularly in high-touch areas. 44. An N95 respirator must be fit tested annually for healthcare workers. True or false? Answer: true. Rationale: annual fit testing ensures the N95 respirator forms a proper seal to provide effective protection against airborne pathogens. 45. Sharing patient equipment, such as stethoscopes, is acceptable without cleaning between uses. True or false? Answer: false. Rationale: shared equipment must be cleaned and disinfected between patients to prevent cross-contamination. 46. Healthcare workers should stay home if experiencing symptoms of an infectious illness. True or false? Answer: true. Rationale: staying home when ill prevents the spread of infection to patients, coworkers, and others in the healthcare setting. 47. The most effective way to reduce catheter-associated urinary tract infections, CAUTIs, is to use catheters only when medically necessary. True or false? Answer: true. Rationale: limiting catheter use to essential cases reduces the risk of CAUTIs by minimizing exposure to potential infection. 48. Double gloving is required for all surgical procedures. True or false? Answer: false. Rationale: double gloving is recommended for high-risk procedures, but is not required for all surgical procedures. 49. Regular environmental cleaning reduces the risk of healthcare-associated infections, HAIs. True or false? Answer: true. Rationale: environmental cleaning removes pathogens from surfaces, reducing the risk of HAIs and improving patient safety. 50. An autoclave is used for disinfecting reusable equipment. True or false? Answer: false. Rationale: an autoclave is used for sterilizing equipment, not disinfecting it. Sterilization eliminates all microorganisms, including spores. 51. Masks should always be removed by handling the ear loops or ties. True or false? Answer: true. Rationale: handling masks by the ear loops or ties prevents contamination of the hands or face. 52. Isolation gowns must be removed before leaving the patient's room. True or false? Answer: true. Rationale: removing isolation gowns before exiting the patient's room prevents the spread of contaminants to other areas. 53. Eye protection is required when there is a risk of exposure to splashes or sprays. True or false? Answer: true. Rationale: eye protection, such as goggles or face shields, protects the mucous membranes from exposure to infectious splashes or sprays. 54. Healthcare workers must wear sterile gloves when handling clean linens. True or false? Answer: false. Rationale: clean, non-sterile gloves are sufficient for handling clean linens. Sterile gloves are only required for sterile procedures. 55. Alcohol-based hand rubs are effective against most common pathogens in healthcare settings. True or false? Answer: true. Rationale: alcohol-based hand rubs are effective against many bacteria and viruses, except for certain pathogens like Clostridioides difficile spores, where handwashing with soap and water is preferred. 56. Droplet precautions require patients to wear a surgical mask when being transported. True or false? Answer: true. Rationale: patients under droplet precautions should wear a surgical mask during transport to prevent the spread of infectious respiratory droplets to others. 57. Gloves must be worn during all patient interactions, regardless of the task. True or false? Answer: false. Rationale: gloves are not required for all patient interactions. They are used when there is a risk of exposure to blood, body fluids, or other potentially infectious materials. 58. Soiled linens should be placed in a covered container immediately. True or false? Answer: true. Rationale: soiled linens should be placed in a covered container to minimize exposure to pathogens and reduce cross-contamination. 59. The use of chlorhexidine for skin antisepsis reduces the risk of surgical site infections. True or false? Answer: true. Rationale: chlorhexidine is an effective antiseptic that significantly reduces microbial load on the skin, thereby lowering the risk of surgical site infections. 60. Healthcare workers should shake out linens before placing them in a hamper. True or false? Answer: false. Rationale: shaking linens can release pathogens into the air, increasing the risk of airborne contamination. Linens should be handled gently to avoid dispersing microorganisms. 61. Safe patient handling equipment, like mechanical lifts, prevents healthcare worker injuries. True or false? Answer: true. Rationale: mechanical lifts and other safe patient handling equipment reduce the risk of musculoskeletal injuries among healthcare workers by minimizing manual lifting and repositioning tasks. 62. High-touch surfaces, such as bed rails, should be cleaned once a day. True or false? Answer: false. Rationale: high-touch surfaces should be cleaned frequently, often multiple times a day, to reduce the risk of healthcare-associated infections. 63. Hand-washing with soap and water is the preferred method when hands are visibly soiled. True or false? Answer: true. Rationale: hand-washing with soap and water is the most effective way to remove visible dirt, organic material, and pathogens, including those not effectively eliminated by alcohol-based hand rubs. 64. Healthcare workers should change PPE between caring for patients in the same room. True or false? Answer: true. Rationale: changing PPE between patients, even in the same room, prevents cross-contamination and protects both patients and healthcare workers. 65. The sterile field can be left unattended as long as it remains covered. True or false? Answer: false. Rationale: a sterile field should never be left unattended, as it cannot be guaranteed to remain sterile without direct supervision. 66. Masks used for airborne precautions must be discarded immediately after use. True or false? Answer: true. Rationale: masks used for airborne precautions should be disposed of after use to prevent contamination and maintain infection control standards. 67. Patients on contact precautions should be provided with disposable food trays and utensils. True or false? Answer: true. Rationale: disposable food trays and utensils minimize the risk of cross-contamination when handling items used by patients on contact precautions. 68. Hand hygiene is required before and after putting on sterile gloves. True or false? Answer: true. Rationale: hand hygiene is necessary to prevent contamination of gloves during donning and to remove any contaminants after glove removal. 69. The primary goal of patient safety protocols is to improve patient satisfaction. True or false? Answer: false. Rationale: while improving patient satisfaction is important, the primary goal of patient safety protocols is to prevent harm and ensure optimal care outcomes. 70. Healthcare workers should assess all patients for fall risk on admission. True or false? Answer: true. Rationale: fall risk assessments help identify patients at risk for falls and enable the implementation of preventive measures. 71. Standard precautions apply to all patients regardless of their infection status. True or false? Answer: true. Rationale: standard precautions are designed to prevent the spread of infection and are applied universally to all patients, regardless of known or suspected infections. 72. A sharps container should be filled to capacity before disposal. True or false? Answer: false. Rationale: sharps containers should be disposed of when they are 3/4 full to prevent overfilling and the risk of needle stick injuries. 73. Contact precautions require the use of gloves and a gown. True or false? Answer: true. Rationale: gloves and gowns are required for contact precautions to prevent the transmission of infectious agents through direct or indirect contact with contaminated surfaces or patients. 74. Proper positioning of bed rails can prevent patient falls. True or false? Answer: true. Rationale: proper use of bed rails can prevent falls by providing support and reducing the risk of patients rolling out of bed. 75. Healthcare workers should clean stethoscopes after every patient use. True or false? Answer: true. Rationale: cleaning stethoscopes after each use prevents the spread of pathogens between patients and maintains hygiene standards. 76. It is safe to reuse a disposable gown after it has been disinfected. True or false? Answer: false. Rationale: disposable gowns are designed for single use and cannot be effectively disinfected for reuse, as this compromises their integrity and safety. 77. Safe injection practices include using one needle and one syringe per patient. True or false? Answer: true. Rationale: using a new needle and syringe for each patient prevents cross-contamination and transmission of infections. 78. Patients with MRSA require airborne precautions. True or false? Answer: false. Rationale: patients with MRSA typically require contact precautions, as MRSA is transmitted via direct or indirect contact, not airborne transmission. 79. Sharp instruments should be disposed of immediately after use. True or false? Answer: true. Rationale: immediate disposal of sharp instruments into a sharps container reduces the risk of accidental needle stick injuries. 80. Hand hygiene should be performed before and after using alcohol-based hand sanitizer. True or false? Answer: false. Rationale: alcohol-based hand sanitizer itself constitutes hand hygiene and does not require additional hand washing unless hands are visibly soiled or contaminated. 81. Transmission-based precautions are implemented based on the mode of infection transmission. True or false? Answer: true. Rationale: transmission-based precautions target specific pathogens and their modes of transmission, such as contact, droplet, or airborne spread. 82. Clostridioides difficile infections require hand washing with soap and water. True or false? Answer: true. Rationale: hand washing with soap and water is necessary to remove C. difficile spores, as alcohol-based hand sanitizers are ineffective against spores. 83. Safety protocols in the healthcare environment only apply to patients, not healthcare workers. True or false? Answer: false. Rationale: safety protocols protect both patients and healthcare workers from harm, ensuring a safe environment for everyone. 84. Proper use of a HEPA filter in an isolation room reduces the spread of airborne pathogens. True or false? Answer: true. Rationale: HEPA filters effectively trap airborne pathogens, preventing their spread and maintaining air quality in isolation rooms. 85. Healthcare workers should report any safety hazards in the workplace immediately. True or false? Answer: true. Rationale: prompt reporting of safety hazards allows for timely interventions and reduces the risk of harm to patients and staff. 86. Masks must be worn at all times in a negative pressure isolation room. True or false? Answer: true. Rationale: negative pressure rooms are used for airborne precautions, and masks must be worn to prevent the spread of airborne pathogens. 87. Single-use equipment must be discarded after use, even if it appears clean. True or false? Answer: true. Rationale: single-use equipment is designed for one-time use and cannot be properly disinfected for reuse, ensuring patient safety. 88. Healthcare workers can use alcohol-based hand sanitizer after handling food trays. True or false? Answer: true. Rationale: alcohol-based hand sanitizer is effective after handling food trays unless hands are visibly soiled, in which case soap and water should be used. 89. Patients with tuberculosis require droplet precautions. True or false? Answer: false. Rationale: Tuberculosis requires airborne precautions because it spreads through fine aerosolized particles, not droplets. 90. Safety data sheets, SDS, provide information on hazardous materials in the healthcare setting. True or false? Answer: true. Rationale: SDS documents contain information about the safe handling, storage, and disposal of hazardous materials, ensuring workplace safety. 91. Healthcare workers should remove gloves by peeling them off without touching the outer surface. True or false? Answer: true. Rationale: proper glove removal minimizes contact with potentially contaminated surfaces, reducing the risk of self-contamination. 92. Bed rails should always be kept in the raised position for all patients. True or false? Answer: false. Rationale: bed rails should be used based on individual patient needs, as continuous use can pose entrapment or restraint risks for some patients. 93. Central line-associated bloodstream infections, CLABSIs, can be prevented by using a septic technique. True or false? Answer: true. Rationale: a septic technique prevents the introduction of pathogens during central line insertion and maintenance, reducing CLABSI risk. 94. The use of personal protective equipment, PPE, eliminates the need for hand hygiene. True or false? Answer: false. Rationale: hand hygiene is essential even when PPE is used, as gloves and gowns do not provide complete protection from contamination. 95. Disinfectants are suitable for cleaning patient skin before invasive procedures. True or false? Answer: false. Rationale: disinfectants are not safe for patient skin. Antiseptics should be used for pre-procedure skin preparation. 96. Surgical masks are adequate for protection during aerosol-generating procedures. True or false? Answer: false. Rationale: N95 respirators or higher-level protection are required for aerosol-generating procedures to effectively filter airborne particles. 97. Sharp instruments should never be recapped after use. True or false? Answer: true. Rationale: recapping needles increases the risk of needle stick injuries and should be avoided unless using a safety device designed for recapping. 98. Open wounds should always be covered with a sterile dressing in a healthcare setting. True or false? Answer: true. Rationale: covering wounds with sterile dressings protects against infection and promotes healing. 99. Visitors to patients under airborne precautions must wear appropriate PPE. True or false? Answer: true. Rationale: visitors need to wear PPE, such as N95 masks, to protect themselves and prevent the spread of airborne infections. 100. Healthcare workers should use the same gloves for multiple tasks on the same patient. True or false? Answer: false. Rationale: gloves should be changed between tasks to prevent cross-contamination, even when working with the same patient. 101. Patients with suspected meningitis require droplet precautions. True or false? Answer: true. Rationale: meningitis caused by bacteria like Neisseria meningitidis is spread through respiratory droplets, requiring droplet precautions. 102. It is acceptable to store clean and soiled linens in the same room. True or false? Answer: false. Rationale: clean and soiled linens must be stored separately to prevent contamination and maintain hygiene. 103. Healthcare workers should perform a risk assessment before initiating transmission-based precautions. True or false? Answer: true. Rationale: risk assessments guide the selection of appropriate precautions based on the patient's infection status and mode of transmission. 104. Eye protection is required for all patient interactions under standard precautions. True or false? Answer: false. Rationale: eye protection is used during procedures or patient interactions where splashes or sprays of infectious material are anticipated. 105. A sterile field should be set up at waist level or higher. True or false? Answer: true. Rationale: setting up a sterile field at waist level or higher maintains sterility by preventing contamination from lower surfaces. 106. Healthcare workers should wash their hands for at least 15 seconds. True or false? Answer: true. Rationale: Hand washing for at least 15 to 20 seconds ensures effective removal of pathogens and dirt. 107. Double gloving is required during all surgical procedures. True or false? Answer: false. Rationale: double gloving is recommended for high-risk procedures, but is not universally required for all surgeries. 108. Antimicrobial resistance can be reduced by appropriate antibiotic stewardship programs. True or false? Answer: true. Rationale: antibiotic stewardship programs ensure the appropriate use of antibiotics, reducing the development of resistance and improving patient outcomes. 109. Healthcare workers should avoid wearing artificial nails in patient care areas. True or false? Answer: true. Rationale: artificial nails can harbor pathogens and increase the risk of transmitting infections in healthcare settings. 110. Patients with contact dermatitis require isolation precautions. True or false? Answer: false. Rationale: contact dermatitis is not an infectious condition and does not require isolation precautions. 111. Proper disposal of infectious waste is a component of standard precautions. True or false? Answer: true. Rationale: safe disposal of infectious waste is essential for preventing environmental contamination and protecting healthcare workers and patients. 112. The sterile field is considered contaminated if someone reaches over it. True or false? Answer: true. Rationale: reaching over a sterile field can introduce contaminants and compromise sterility. 113. An N95 respirator must be fit tested before use. True or false? Answer: true. Rationale: fit testing ensures the respirator provides an adequate seal and protection against airborne particles. 114. Healthcare workers should always assume that patients' blood and body fluids are infectious. True or false? Answer: true. Rationale: universal precautions dictate that all blood and body fluids are treated as potentially infectious to prevent transmission. 115. Room doors for patients on droplet precautions should always remain closed. True or false? Answer: false. Rationale: room doors for droplet precautions can remain open, but healthcare workers must wear appropriate PPE to prevent droplet transmission. 116. Vaccination of healthcare workers reduces the risk of healthcare-associated infections. True or false? Answer: true. Rationale: vaccination protects healthcare workers from infections and reduces the risk of transmitting vaccine-preventable diseases to patients. 117. Sterilization and disinfection are interchangeable terms. True or false? Answer: false. Rationale: sterilization eliminates all microorganisms, while disinfection reduces their numbers to safe levels but does not necessarily eliminate all pathogens. 118. Antiseptics are used to clean non-living surfaces. True or false? Answer: false. Rationale: antiseptics are used to clean living tissues, such as skin, whereas disinfectants are used for non-living surfaces. 119. Healthcare workers should change face masks every 4 hours during extended shifts. True or false? Answer: true. Rationale: masks should be replaced regularly, especially if they become damp or soiled, to maintain effectiveness. 120. Hand hygiene compliance is a shared responsibility among all healthcare workers. True or false? Answer: true. Rationale: all healthcare workers must adhere to hand hygiene protocols to minimize the spread of infections. 121. Proper storage of sterile supplies ensures their sterility. True or false? Answer: true. Rationale: sterile supplies must be stored in a clean, dry environment to maintain sterility and prevent contamination. 122. Healthcare workers should perform hand hygiene before putting on and after removing gloves. True or false? Answer: true. Rationale: hand hygiene prevents the transfer of pathogens during the donning and removal of gloves, reducing cross-contamination. 123. Patients on contact precautions should have dedicated medical equipment. True or false? Answer: true. Rationale: using dedicated equipment minimizes the risk of cross-contamination between patients. 124. It is safe to recap a used needle using a one-handed technique. True or false? Answer: true. Rationale: if recapping is necessary, a one-handed technique is safer and reduces the risk of needle stick injuries. 125. The risk of falls increases with improper footwear in healthcare settings. True or false? Answer: true. Rationale: proper footwear provides stability and reduces the risk of slipping or tripping, preventing falls. 126. Healthcare workers should disinfect reusable medical devices before sterilization. True or false? Answer: true. Rationale: disinfection removes surface debris and reduces microbial load, which is essential before sterilization. 127. Patients with siege difficile infection should use alcohol-based hand sanitizer for hand hygiene. True or false? Answer: false. Rationale: soap and water are required for effective hand hygiene in cases of C. difficile infection, as alcohol-based hand sanitizers are ineffective against spores. 128. Healthcare workers must perform hand hygiene after removing PPE. True or false? Answer: true. Rationale: hand hygiene after PPE removal prevents the transmission of contaminants that may have been transferred during removal. 129. Negative pressure rooms are used to isolate patients with diseases transmitted by contact. True or false? Answer: false. Rationale: negative pressure rooms are used for airborne diseases, not contact-transmitted infections. 130. An improperly maintained sterile field can lead to surgical site infections. True or false? Answer: true. Rationale: contamination of a sterile field increases the risk of surgical site infections due to exposure to pathogens. 131. Healthcare workers should shake used linens before placing them in designated bags. True or false? Answer: false. Rationale: shaking linens can release pathogens into the air, increasing the risk of airborne contamination. 132. Patients on droplet precautions should wear masks during transport. True or false? Answer: true. Rationale: patients on droplet precautions should wear masks during transport to prevent the spread of infectious droplets. 133. Using gloves eliminates the need for frequent hand hygiene. True or false? Answer: false. Rationale: gloves do not provide complete protection, and hand hygiene is required before and after glove use to prevent contamination. 134. Healthcare workers can use personal phones while wearing sterile gloves. True or false? Answer: false. Rationale: using personal phones compromises sterility and increases the risk of contamination. 135. Open wounds must be covered with a clean, dry dressing to prevent infection. True or false? Answer: true. Rationale: covering wounds with a clean dressing protects against infection and promotes healing. 136. A sterile item remains sterile if placed on a wet surface. True or false? Answer: false. Rationale: moisture can act as a conduit for contaminants, compromising the sterility of the item. 137. Droplet precautions require the use of an N95 respirator. True or false? Answer: false. Rationale: standard masks are sufficient for droplet precautions, whereas airborne precautions require N95 respirators. 138. Eye protection is optional when there is a risk of blood splashes. True or false? Answer: false. Rationale: eye protection is mandatory when there is a risk of exposure to blood or bodily fluids through splashes. 139. Hand hygiene is the most effective way to prevent the spread of infection. True or false? Answer: true. Rationale: hand hygiene is the cornerstone of infection prevention, reducing the transmission of pathogens. 140. Healthcare workers should immediately report all needle stick injuries. True or false? Answer: true. Rationale: prompt reporting of needle stick injuries allows for timely assessment and intervention to prevent potential infections. 141. Soiled linens can be placed directly on the floor if no bag is available. True or false? Answer: false. Rationale: Placing soiled linens on the floor increases the risk of environmental contamination and infection. 142. Healthcare workers should follow standard precautions for all patients, regardless of diagnosis. True or false? Answer: true. Rationale: standard precautions ensure the prevention of transmission of infections from all patients, as their infectious status may be unknown. 143. Alcohol-based hand sanitizers are effective against most pathogens, including norovirus. True or false? Answer: false. Rationale: soap and water are more effective against norovirus, as alcohol-based sanitizers may not fully eliminate it. 144. Closed-toe shoes are required in healthcare settings for safety reasons. True or false? Answer: true. Rationale: closed-toe shoes protect healthcare workers from spills, dropped objects, and potential contamination. 145. Healthcare workers must label and date all open sterile solutions. True or false? Answer: true. Rationale: proper labeling ensures the timely use and safe handling of open sterile solutions, preventing contamination. 146. Patients with measles require droplet precautions. True or false? Answer: false. Rationale: measles is transmitted through airborne particles, requiring airborne precautions. 147. Bedside commodes must be cleaned after each use to prevent infections. True or false? Answer: true. Rationale: regular cleaning prevents the spread of pathogens and ensures a hygienic environment. 148. Healthcare workers should use sterile gloves for all patient care activities. True or false? Answer: false. Rationale: sterile gloves are used for invasive procedures, while clean gloves are sufficient for most routine care. 149. Food and drinks are allowed in patient care areas if kept covered. True or false? Answer: false. Rationale: food and drinks are prohibited in patient care areas to prevent contamination and ensure a clean environment. 150. Needles should never be bent or broken before disposal. True or false? Answer: true. Rationale: bending or breaking needles increases the risk of injury and improper disposal. 151. Patients on airborne precautions can share a room with another patient with the same infection. True or false? Answer: true. Rationale: cohorting patients with the same infection is an acceptable practice in specific cases to optimize resources. 152. Healthcare workers can wear the same gown for multiple patients under contact precautions. True or false? Answer: false. Rationale: a new gown must be used for each patient to prevent cross-contamination. 153. Vaccines are essential for protecting healthcare workers and patients from preventable diseases. True or false? Answer: true. Rationale: vaccination reduces the risk of outbreaks and ensures a safer healthcare environment. 154. The sterile field must remain within the healthcare worker's line of sight. True or false? Answer: true. Rationale: keeping the sterile field within sight ensures its sterility is not compromised by unintentional contamination. 155. Isolation precautions can be discontinued immediately after symptoms resolve. True or false? Answer: false. Rationale: precautions must continue until the infectious period has passed or diagnostic tests confirm the absence of the pathogen. 156. Healthcare workers must use soap and water after caring for patients with suspected anthrax exposure. True or false? Answer: true. Rationale: soap and water are required to effectively remove anthrax spores from the skin. 157. Disinfectants used in healthcare settings must be approved by regulatory agencies. True or false? Answer: true. Rationale: approved disinfectants meet safety and efficacy standards, ensuring they effectively reduce pathogens. 158. Patients with influenza require airborne precautions. True or false? Answer: false. Rationale: influenza spreads via droplets, requiring droplet precautions. 159. Healthcare workers can wear jewelry during invasive procedures. True or false? Answer: false. Rationale: Jewelry can harbor pathogens and compromise sterility, so it must be removed during invasive procedures. 160. Frequent environmental cleaning reduces healthcare-associated infections, HAIs. True or false? Answer: true. Rationale: regular cleaning reduces the presence of pathogens on surfaces, minimizing the risk of HAIs. 161. Patients with confirmed MRSA infection require airborne precautions. True or false? Answer: false. Rationale: MRSA is transmitted through contact, requiring contact precautions, not airborne. 162. Healthcare workers should always use gloves when administering injections. True or false? Answer: true. Rationale: gloves protect against potential exposure to bloodborne pathogens during injections. 163. Healthcare workers can substitute alcohol-based hand sanitizer for soap and water when hands are visibly soiled. True or false? Answer: false. Rationale: visibly soiled hands require washing with soap and water for effective cleaning. 164. It is acceptable to share a stethoscope between patients without cleaning it. True or false? Answer: false. Rationale: stethoscopes must be cleaned between uses to prevent cross-contamination. 165. Patients with varicella, chickenpox, require both airborne and contact precautions. True or false? Answer: true. Rationale: varicella is transmitted via airborne particles and direct contact with lesions, requiring both precautions. 166. Shark containers should be replaced when they are 3/4 full. True or false? Answer: true. Rationale: overfilled containers increase the risk of needle stick injuries and improper disposal. Sharp containers must be replaced when they are 3/4 full to ensure safety and compliance with infection control protocols. 167. It is acceptable to eat in patient care areas as long as the food is packaged. True or false? Answer: false. Rationale: food should not be consumed in patient care areas to avoid contamination and maintain a sterile environment. 168. Healthcare workers should wear masks when working with patients who have respiratory infections. True or false? Answer: true. Rationale: masks prevent the transmission of respiratory droplets, reducing the risk of infection. 169. Proper hand hygiene should be performed before and after touching patient equipment. True or false? Answer: true. Rationale: hand hygiene is essential to prevent the transfer of pathogens to and from patient equipment. 170. It is safe to use the same syringe for multiple injections in different patients. True or false? Answer: false. Rationale: syringes should never be reused, as they can transmit pathogens between patients. 171. Gloves should be worn when performing procedures that involve contact with blood or body fluids. True or false? Answer: true. Rationale: gloves help protect healthcare workers from exposure to bloodborne pathogens and reduce the risk of infection transmission. 172. Alcohol-based hand sanitizers are not effective in killing norovirus. True or false? Answer: true. Rationale: alcohol-based hand sanitizers are not effective against norovirus, which requires soap and water for thorough hand hygiene. 173. Personal protective equipment, PPE, should be worn only if a patient has a diagnosed infection. True or false? Answer: false. Rationale: PPE should be worn based on the level of exposure risk, not just the diagnosis, to protect healthcare workers and prevent cross-contamination. 174. Standard precautions are only required for patients who have known infections. True or false? Answer: false. Rationale: standard precautions should be used for all patients, regardless of their infection status, to prevent the transmission of infectious agents. 175. When disposing of contaminated items, they should be placed in the nearest trash bin. True or false? Answer: false. Rationale: contaminated items should be disposed of in designated waste containers, such as biohazard bags or sharp containers, to prevent exposure to infectious materials. 176. Hand hygiene should be performed after removing gloves. True or false? Answer: True. Rationale. Hand hygiene should always be performed after removing gloves to remove any potential contaminants that may have been transferred during glove removal. 177. Isolation gowns should be worn when providing care to patients in airborne precautions. True or false? Answer: true. Rationale. Isolation gowns protect healthcare workers from exposure to potentially infectious materials during patient care, particularly in airborne precautions. 178. The use of hand sanitizer is preferable to soap and water when hands are visibly soiled. True or false? Answer: false. Rationale. Soap and water should be used when hands are visibly soiled to ensure the removal of dirt, debris, and pathogens. Hand sanitizer is effective when hands are not visibly dirty. 179. Personal protective equipment should be discarded after each use, even if the item appears clean. True or false? Answer: true. Rationale. PPE should be discarded after each use to minimize the risk of cross-contamination and exposure to infectious agents, even if the items appear clean. 180. Healthcare workers should disinfect their stethoscopes between patients. True or false? Answer: true. Rationale. Stethoscopes can harbor pathogens and should be disinfected between patients to reduce the risk of cross-contamination. 181. When caring for a patient with a multi-drug-resistant infection, gloves and gown are the only PPE required. True or false? Answer: false. Rationale. Depending on the infection and the level of exposure risk, additional PPE such as masks, eye protection, or respiratory protection may be required when caring for patients with multi-drug-resistant infections. 182. It is acceptable to reuse disposable needles if they are not visibly contaminated. True or false? Answer: false. Rationale. Disposable needles should never be reused, even if they are not visibly contaminated, to avoid the risk of transmitting infections and ensuring patient safety. 183. Sterile technique should be used when inserting a catheter. True or false? Answer: true. Rationale. A sterile technique is necessary when inserting a catheter to prevent infection and ensure the patient's safety. 184. Contaminated linen should be handled with care to avoid contact with the skin or clothing of healthcare workers. True or false? Answer: true. Rationale. Contaminated linen should be handled carefully to prevent exposure to pathogens and avoid contamination of healthcare workers. 185. Alcohol wipes can be used to disinfect surfaces contaminated with C. difficile. True or false? Answer: false. Rationale. C. difficile spores are not effectively killed by alcohol wipes. Disinfectants with chlorine bleach or other specific agents are required for proper disinfection. 186. Patients who are placed in isolation should be visited only by essential healthcare personnel. True or false? Answer: true. Rationale. Limiting visits to essential personnel reduces the risk of infection transmission to others, especially for patients in isolation. 187. It is important to clean hands after every patient interaction, even if gloves were worn. True or false? Answer: true. Rationale. Cleaning hands after every patient interaction, regardless of glove use, reduces the risk of cross-contamination and infection transmission. 188. A healthcare worker should use the same pair of gloves for multiple patient encounters if not visibly soiled. True or false? Answer: false. Rationale. Gloves should be changed between patient encounters to avoid the risk of cross-contamination and maintain patient safety. 189. Healthcare workers can wear jewelry while providing patient care as long as it does not interfere with patient treatment. True or false? Answer: false. Rationale. Jewelry can harbor pathogens and interfere with hand hygiene, so it should not be worn while providing patient care to minimize infection risks. 190. If a patient has a respiratory infection, healthcare workers should wear a surgical mask during close contact. True or false? Answer: true. Rationale. Surgical masks help prevent the transmission of respiratory droplets and protect healthcare workers from infectious agents during close contact. 191. Hand hygiene is only necessary before performing invasive procedures. True or false? Answer: false. Rationale: hand hygiene is necessary before and after patient contact, before invasive procedures, and after touching patient equipment to prevent infection transmission. 192. When cleaning patient rooms, it is sufficient to clean only surfaces that are visibly dirty. True or false? Answer: false. Rationale: all patient room surfaces, including frequently touched areas, should be cleaned regularly to reduce the risk of infection, even if they are not visibly dirty. 193. The use of alcohol-based hand sanitizers is sufficient when caring for patients with Clostridium difficile. True or false? Answer: false. Rationale: Clostridium difficile requires soap and water for effective hand hygiene because alcohol-based hand sanitizers do not kill the spores of this pathogen. 194. It is acceptable to use the same syringe for multiple injections in the same patient. True or false? Answer: true. Rationale: reusing syringes for the same patient is acceptable only if the syringe is not contaminated and it is used in accordance with safety protocols. 195. Infectious waste should be disposed of in a designated biohazard bag or container. True or false? Answer: true. Rationale: infectious waste must be disposed of in a designated biohazard bag or container to prevent exposure to healthcare workers and others. 196. A patient with an open wound can be treated without PPE as long as the wound is covered. True or false? Answer: false. Rationale: PPE should always be worn when caring for patients with open wounds to protect healthcare workers from exposure to bloodborne pathogens or infectious materials. 197. If a patient is receiving chemotherapy, they are at higher risk for infections and should be closely monitored. True or false? Answer: true. Rationale: chemotherapy suppresses the immune system, making patients more susceptible to infections and requiring careful monitoring and infection control measures. 198. A clean technique is sufficient when caring for patients with a urinary tract infection. True or false? Answer: false. Rationale: a sterile technique should be used to prevent the introduction of pathogens when caring for patients with urinary tract infections, especially during catheter insertion or handling. 199. Healthcare workers should wash hands immediately after touching patient records. True or false? Answer: true. Rationale: touching patient records can transfer pathogens, so healthcare workers should wash their hands after handling patient records to prevent cross-contamination. 200. It is acceptable to share personal protective equipment among healthcare workers if it is not visibly contaminated. True or false? Answer: false. Rationale: PPE should not be shared among healthcare workers, as it can lead to cross-contamination and increase the risk of infection. 201. If a healthcare worker touches a patient's contaminated clothing, gloves should be immediately changed. True or false? Answer: true. Rationale: contaminated clothing can transfer infectious agents to gloves, increasing the risk of cross-contamination. Gloves should be changed immediately after contact with contaminated clothing to ensure patient safety. 202. It is safe to perform a sterile procedure if only the instruments are sterile, even if the environment is not. True or false? Answer: false. Rationale: the environment must also be sterile to prevent contamination during sterile procedures. A sterile environment is essential for maintaining the integrity of the procedure. 203. Personal protective equipment, PPE, should be donned before entering a patient's room with an airborne infection. True or false? Answer: true. Rationale: PPE should be donned before entering the room of a patient with an airborne infection to prevent exposure to airborne pathogens. This includes a fit-tested N95 respirator, gloves, gown, and eye protection if needed. 204. A patient with a communicable disease should always be isolated in a private room. True or false? Answer: false. Rationale: isolation in a private room depends on the type of infection and transmission mode. Some patients with communicable diseases may share a room if they have the same infection and appropriate precautions are followed. 205. Cleaning of hands is unnecessary if a healthcare worker uses gloves during patient care. True or false? Answer: false. Rationale: Hand hygiene should be performed regardless of glove use, as gloves can become contaminated during patient care. Proper hand hygiene before and after patient contact is critical to reduce the spread of infections. 206. A patient who has a multi-drug-resistant infection should be placed under contact precautions. True or false? Answer: true. Rationale: contact precautions are used for patients with multi-drug-resistant infections to prevent the transmission of resistant pathogens to other patients and healthcare workers. 207. Surgical masks should be worn when caring for patients with gastrointestinal infections. True or false? Answer: false. Rationale: surgical masks are not required for gastrointestinal infections. However, if the patient has vomiting or diarrhea, precautions may include wearing gloves and gowns to avoid contact with bodily fluids. 208. Antiseptic hand rubs are ineffective at killing certain pathogens like Clostridium difficile. True or false? Answer: true. Rationale: antiseptic hand rubs are ineffective at removing spores like those of Clostridium difficile. Hand washing with soap and water is necessary to remove spores effectively. 209. A patient with a wound infection should be placed on droplet precautions. True or false? Answer: false. Rationale: wound infections require contact precautions, not droplet precautions, to minimize the risk of transmission of infectious agents through direct contact with contaminated surfaces or wound exudate. 210. Hand hygiene should be performed after removing contaminated gloves. True or false? Answer: true. Rationale: hand hygiene should always be performed after removing contaminated gloves to prevent transferring infectious material to other surfaces or individuals. 211. If a healthcare worker is exposed to a patient's blood, they should report the exposure immediately. True or false? Answer: true. Rationale: immediate reporting of blood exposure allows for proper testing, post-exposure prophylaxis, PEP, and documentation to ensure the safety of the healthcare worker and prevent transmission of bloodborne pathogens. 212. Personal protective equipment, PPE, is not necessary if the patient is receiving care in a standard hospital room. True or false? Answer: false. Rationale: PPE is necessary based on the patient's condition and the level of exposure risk, not just the type of room. Even in a standard room, PPE may be required if the patient has an infectious disease or when performing certain procedures. 213. Infection control protocols should be adapted based on the level of a patient's immune system suppression. True or false? Answer: true. Rationale: immunocompromised patients are more vulnerable to infections, so infection control measures should be more stringent to protect them from healthcare-associated infections. 214. Reusing disposable equipment such as syringes is acceptable if it is cleaned thoroughly. True or false? Answer: false. Rationale: disposable equipment like syringes should never be reused, even after cleaning, as it can lead to cross-contamination and infection transmission. 215. Healthcare workers should disinfect their phones between patient care activities. True or false? Answer: true. Rationale: mobile phones can harbor pathogens, so healthcare workers should disinfect their phones between patient care activities to prevent the spread of infections. 216. Hand hygiene should be performed after touching a patient's bed linens. True or false? Answer: true. Rationale: bed linens can become contaminated with pathogens, and hand hygiene should be performed after contact with linens to reduce the risk of transmission. 217. It is safe to leave used PPE in the patient's room for later disposal. True or false? Answer: false. Rationale: used PPE should be immediately discarded in appropriate containers to avoid cross-contamination and prevent exposure to pathogens. 218. Sterile technique is required for inserting a peripheral intravenous for catheter. True or false? Answer: true. Rationale: inserting a peripheral for catheter requires sterile technique to prevent introducing pathogens into the bloodstream, which could result in an infection. 219. If a healthcare worker has a cut or wound on their hands, they should wear gloves at all times while providing care. True or false? Answer: true. Rationale: A healthcare worker with a cut or wound on their hands should wear gloves to protect both themselves and patients from potential infection transmission. 220. Patients with MRSA, methicillin-resistant Staphylococcus aureus, should be placed on airborne precautions. True or false? Answer: false. Rationale: MRSA is transmitted through direct contact, so patients should be placed on contact precautions, not airborne precautions. 221. When handling contaminated instruments, it is essential to wear gloves and a gown. True or false? Answer: true. Rationale: wearing gloves and a gown helps protect healthcare workers from exposure to infectious agents when handling contaminated instruments. 222. When a healthcare worker is performing a sterile dressing change, they should avoid touching any non-sterile surfaces. True or false? Answer: true. Rationale: non-sterile surfaces can introduce pathogens into the sterile field. To maintain a sterile environment, healthcare workers should avoid touching non-sterile surfaces during dressing changes. 223. Patients with respiratory infections should wear a surgical mask to prevent the spread of infection. True or false? Answer: true. Rationale: a surgical mask prevents respiratory droplets from being expelled into the air, reducing the risk of spreading respiratory infections to others. 224. Is acceptable to store medications in the patient's room in unsecured containers. True or false? Answer: false. Rationale: medications should always be securely stored to prevent unauthorized access and accidental medication errors, as well as to ensure patient safety. 225. A healthcare worker should clean their hands after leaving a patient's room, even if gloves were worn during the visit. True or false? Answer: true. Rationale: hand hygiene should always be performed after leaving a patient's room to remove any potential contamination that may have occurred even if gloves were worn. 226. When handling sharps, it is important to recap needles before disposal. True or false? Answer: false. Rationale: needles should never be recapped to avoid accidental needle stick injuries. They should be disposed of immediately in a proper sharps container. 227. Alcohol-based hand rubs can be used to clean visibly soiled hands. True or false? Answer: false. Rationale: alcohol-based hand rubs are ineffective at cleaning visibly soiled hands. Soap and water should be used instead to ensure proper removal of dirt and debris. 228. Healthcare workers should wear gloves when assisting with activities of daily living for patients with wounds. True or false? Answer: true. Rationale: gloves should be worn when assisting with activities of daily living, especially for patients with wounds, to prevent contact with potentially infectious material and minimize the risk of cross-contamination. 229. Visitors to patients with infectious diseases should wear the same PPE as healthcare workers. True or false? Answer: false. Rationale: visitors should wear PPE as appropriate based on their exposure risk, but it may not be necessary to wear the same PPE as healthcare workers in all situations. Visitors should follow the facility's guidelines for PPE use. 230. Reuse of sterile needles between patients is prohibited by infection control policies. True or false? Answer: true. Rationale: reusing sterile needles between patients is prohibited to avoid cross-contamination and ensure patient safety. 231. Hand hygiene must be performed before and after performing any procedure involving patient contact. True or false? Answer: true. Rationale: hand hygiene is crucial to prevent the transmission of infections before and after any patient procedure to maintain patient safety and reduce the risk of cross-contamination. 232. Personal protective equipment, PPE, should be disposed of in the same container used for general waste. True or false? Answer: false. Rationale: PPE should be disposed of in designated containers, such as biohazard bags or sharps containers, to prevent contamination of general waste and reduce infection risks. 233. Healthcare workers should never wear artificial nails or nail polish when providing patient care. True or false? Answer: true. Rationale: artificial nails and nail polish can harbor pathogens and make proper hand hygiene difficult, so healthcare workers should avoid wearing them to reduce the risk of infection transmission. 234. It is safe to remove gloves and perform hand hygiene if the gloves are visibly soiled. True or false? Answer: true. Rationale: if gloves are visibly soiled, they should be removed immediately and proper hand hygiene should be performed to prevent contamination. 235. Airborne precautions are required for patients with tuberculosis, TB. True or false? Answer: true. Rationale: tuberculosis is transmitted through airborne particles, so patients with TB must be placed under airborne precautions to reduce the risk of transmission to other individuals. 236. Patients with gastrointestinal infections should be placed on droplet precautions. True or false? Answer: false. Rationale: gastrointestinal infections are transmitted through the fecal-oral route, and contact precautions are required rather than droplet precautions. 237. It is essential to perform hand hygiene before caring for a patient's wound. True or false? Answer: true. Rationale: performing hand hygiene before wound care reduces the risk of introducing infectious agents into the wound and minimizes cross-contamination. 238. A healthcare worker should wash their hands after touching a patient's chart. True or false? Answer: true. Rationale: patient charts can become contaminated with pathogens and require hand hygiene after handling to prevent cross-contamination. 239. Gloves are not required when handling medications that are in sealed packaging. True or false? Answer: false. Rationale: even though medications are in sealed packaging, gloves should be worn when handling to minimize the risk of contamination and ensure safety. 240. Patients with flu-like symptoms should be given isolation precautions until confirmed negative for infectious diseases. True or false? Answer: true. Rationale: until diagnostic tests confirm the nature of flu-like symptoms, patients should be isolated to prevent the potential spread of communicable diseases. 241. Infection control policies must be reviewed regularly to stay up to date with new guidelines. True or false? Answer: true. Rationale: infection control policies should be reviewed and updated regularly to ensure they reflect the latest evidence-based guidelines and best practices in patient care. 242. Alcohol-based hand rubs are effective for removing visible dirt and debris from hands. True or false? Answer: false. Rationale: alcohol-based hand rubs are not effective for cleaning visibly soiled hands. Soap and water should be used when hands are visibly dirty. 243. It is acceptable to touch a patient's personal items without performing hand hygiene. True or false? Answer: false. Rationale: personal items can carry infectious agents. Hand hygiene should always be performed before and after touching a patient's personal items to minimize the risk of spreading infection. 244. When cleaning surfaces in patient care areas, a diluted bleach solution is a suitable disinfectant for most pathogens. True or false? Answer: true. Rationale: diluted bleach solutions are effective at killing many pathogens, including viruses and bacteria, making it a suitable disinfectant in healthcare settings. 245. It is safe to reuse a single-use sterile syringe if it is sterilized properly. True or false? Answer: false. Rationale: single-use syringes should never be reused, even if sterilized, as doing so can lead to contamination and the spread of infection. 246. PPE should be disposed of in the patient's room after use. True or false? Answer: true. Rationale: PPE should be removed and disposed of in the patient's room or at the point of care to prevent contamination of other areas. 247. Healthcare workers can wear jewelry such as rings and bracelets during patient care as long as they are cleaned regularly. True or false? Answer: false. Rationale: jewelry can harbor pathogens, and wearing it during patient care increases the risk of infection. Healthcare workers should avoid wearing jewelry in clinical settings to maintain hand hygiene and minimize the risk of infection transmission. 248. Contact precautions should be used for patients with viral respiratory infections like the common cold. True or false? Answer: false. Rationale: viral respiratory infections like the common cold generally require droplet precautions, not contact precautions, unless the patient also has another infection that requires contact precautions. 249. Healthcare workers should avoid touching their face, particularly their eyes, mouth, and nose, during patient care. True or false? Answer: true. Rationale: touching the face during patient care can introduce pathogens into the body, especially through mucous membranes in the eyes, nose, and mouth. 250. It is important to disinfect reusable patient equipment between uses. True or false? Answer: true. Rationale: reusable patient equipment can harbor pathogens. Disinfection between uses is critical to prevent the transmission of infectious agents between patients.